In this video, you'll learn what informed consent is, ways to have a better conversation with your provider, and how to use your brain when making decisions for a better birth experience. I'm Annabelle Carney, and on this channel, I talk about all things pregnancy, birth, and postpartum, and share my family with you guys. So don't forget to hit that subscribe button and ding that little bell down below. So anytime a medical procedure, medication, test, or other treatment is offered to you, even outside of maternity care, you have the legal right to informed consent. So what is informed consent? Informed consent is this collaborative process between you and your care provider that helps you decide what will and what will not be done to your body. And it's not your provider telling you what to do, pressuring you to do something, or doing something without your permission. And in maternity care, informed consent gives you the authority to decide about the care that affects you and your baby. So anytime that a medication is being given, a treatment or procedure is being recommended, your healthcare provider is responsible for explaining the following things to you: why the type of care is being offered, what it would involve, the harms and benefits that are associated with this type of care, and what are your other options, including the pros and cons of those options, as well as the possibility of doing nothing at the present time, known as watchful waiting. So with the understanding that every birth unfolds differently and can be unpredictable, having informed consent is so important to have a positive birth experience. Then there's informed refusal. So if you disagree with your care provider and decide not to accept care, you have the legal right to this, which is called informed refusal. So even if you signed a form agreeing to a particular type of procedure or care, you always have the right to change your mind. You just need to sign a new form. Now, how does informed consent apply to your prenatal care? Well, prenatal appointments can feel rushed, or you just may be anxious and all of a sudden you forget any questions that you had. So never say yes to anything that you feel unsure about or feel pressured to say yes to. So before each visit, I recommend to make a list of questions and jot down answers during your visit. As you're having a discussion with your provider, here are some things that you may say to get more information that you need. Sorry, I'm not following you. Can you please explain this to me? Or, can you show me the research that supports what you're recommending? Where can I get more information on this topic? I have some information I'd like to share with you, then present them with the research or info that you have. I have a question about this topic, and this is the research I found. What are your thoughts on this? Or simply, I'm not ready to make a decision just yet. I'd like to go home and think about it before giving you a definite answer. If this is new to you and you're a bit intimidated, I totally get it, and it's okay. So here is an easy way to remember how to make decisions at every stage by using your brain. B stands for benefits. What are the benefits of having this procedure or intervention? R stands for risks. What are the risks of this process for me and my baby, and how will it affect labor and birth? A stands for alternatives. What are the alternatives to this procedure or medication, and can it be carried out differently, or is there a natural remedy that I can try first? I stands for instinct. What do you feel is right for you? What feels safest? What is your gut telling you? And N stands for nothing. So what happens if I do nothing at all? Is this an urgent decision that I have to make right now? So in a true emergency, a lengthy conversation may not be feasible, though you can still ask questions. But you will need to trust your providers, which is easier to do if you're already comfortable with their approach to care. Now, you don't have to agree with every test, medication, and procedure, but before you disagree, it's important that you know all of the details so you can make the decision that best aligns with your philosophy and values of care and is best for you and your baby. And it doesn't have to be this aggressive or intimidating conversation. So I encourage you to ask all the questions and don't feel bad or ashamed for doing so, because your healthcare provider is there to provide you with the answers to guide your decisions. So when I was working in primary care, I always encouraged my patients to ask me at least one question by the end of our visit, because to me, asking questions helped close that communication gap and encourages patients to be involved with their care. And if you don't feel like you're getting the right prenatal care, or you just don't feel like you're being heard, you always have the right to switch providers at any time without explaining yourself to anyone, period. So hopefully you have a better understanding of what informed consent is and how to have a better discussion with your provider. Having informed consent is so important for every pregnant mama, no matter the setting you plan to give birth in. But it's especially important when you're aiming for this unmedicated birth in a hospital setting, as there are a variety of interventions readily available and offered to you. So what's so intimidating about making decisions? Nothing, when you can rely on your brain. Thanks so much for watching, and I will see you in the next video.